do a lot of treatment for knee pain. So what happens with the knee typically is the tibia, which is the lower leg bone, tends to rotate out like this, so lateral rotation. So we're going to do a knee adjustment to demonstrate this. I'm going to push on this right here, just to move it about 2 or 3 millimeters. Good. So we'll take an activator to stimulate the medial meniscus, which is the inside part of the knee right here. So that, along with strengthening exercise of the quad, helps realign the knee so it heals in the right position. That's it.